Hello. Um, Good morning, everyone. Good afternoon to the different parts of the world, and good evening to some parts of the world. Anyway, so today I will share with you facts about COVID-19 and some emergency plans that centers and family child care providers can do to maintain and protect the health and safety of the children under their care. So I only have 30 minutes to do this, so I am going to use my PowerPoint presentation as we go. All right, the objectives of this class is for you to be aware of some healthy measures and protective devices, or the use of protective devices in compliance with Executive Order 20-74 that requires child care providers care about the health and safety of their children under their care, especially at this time of pandemic. All right, so I divided, or I categorized this into several areas. And so the first area is about what each one of us should know about COVID-19. So the first area is that we should know about COVID-19. What is this COVID-19? I know that you have heard a lot about COVID-19, and today we are going to dig deeper and analyze what we can do to protect ourselves as well as the young children under our care. So we have to know about COVID, know about how it is spread, and then protect yourself and others from COVID-19. And then one thing too is about how do we practice social distancing? How do we prevent the spread of COVID-19 if you are sick or if you have the symptoms? And then at least when you have the symptoms, what should you know that you are risky about for severe illnesses? All right, so we have the first area, know about COVID-19. COVID-19 is an illness caused by a virus that can spread from person to person. The virus that is caused by, that it caused COVID-19 is a new coronavirus that has spread throughout the world. We started in China and then it just spread out throughout. And the symptoms can range from mild or no symptoms at all to severe illnesses. Now, how is this virus spread? So you can become infected by coming into close contact about 6 feet or 2 arm lengths with a person who has symptoms or who has a positive virus or COVID-19. So that's why in stores, in malls, in public places, we are encouraged to stay 6 feet away from other people, because we don't know where they came from, we don't know how they are feeling, and sometimes, you know, if you do not have symptoms, you don't know even that you're already sick. All right, another one is you can also become infected from respiratory droplets when an infected person coughs, sneezes, or talks. In my previous videos, I told you that when you sneeze or cough, you can cough on your bent elbow. So, but this time of the pandemic, we are supposed to cover our cough or sneeze with a tissue and then throw in the trash and wash our hands. So that wears off the virus that is in our hands. We do not catch our sneeze or cough, okay? And then another one is you may also be able to get it by touching a surface or object that has the virus on it and then touching your mouth, nose, or eyes. Therefore, clean and disinfect frequently touched objects and surfaces. Now, what are those frequently touched objects and surfaces? I can give you some. They are doorknobs, light switches, stair rails if you're going up and down a building, tables and chairs, shared toys, those who are in the child care centers, shared toys would also be, and there's a lot more. Later, I will enumerate most of them. And then another one is you may also be able to get it by touching a surface. Oh, sorry, that's been done already. So therefore, we are not encouraged to touch our mouth, our nose, and our eyes. So refrain from touching those sense organs that are big openings for viruses. Instead, when you have touched a surface that you believe there probably could have some virus or any dirt in it on it, you better wash your hands before you touch your eyes and mouth and nose as well. Now, how can you protect yourself and others from COVID-19? Currently, because there is no vaccine to protect us, we just have to avoid being exposed to the virus that causes COVID-19. So, when we are sick, we have to stay at home. Or probably we can call our doctor for an appointment and then you just go there. But please be advised that you should keep distance, have a face covering mask, or just merely stay at home. Probably that is the best thing. Now, another one is wear a cloth face covering that covers your nose and mouth in public settings. So, with this in mind, you see the pictures, all of them have covering on their faces, not only the mouth, as well as the nose. So when you wear your face mask, it should cover your nose and your mouth, especially in public settings. There are also some warning signs outside of the store or a mall or public places which says, wear your face shields or wear your face mask before entering, or it would be kind enough if you can wear your face mask, something like that, because there are some people who are offended by that certain thing. You know, it's just respect. You know, if we don't want to get virus, then we have to cover ourselves. Or if we are sick and we don't want other people to get sick as well, cover yourself too. I mean, cover your mouth and your and your nose. Now, another one is you clean and disinfect frequently touched surfaces. So, whatever disinfectant you are using, the Department of Human Services in Minnesota have sent child care centers and other frontliners free sanitizers, disinfectant for us to use so that we can make sure that everything is safe and healthy for the kids. Whatever you are using, these are only some samples. Please, consistently, it says here, frequently, as much as you could, after the children use the chairs and the tables, sanitize it right away. Don't leave it for several hours before you can clean it for the next use. Now, here are some steps for safe and effective disinfectant use. One is check that your product is EPA approved. You can find that EPA approved registry number on the product, then check to see if it is on the EPA list, emergency product something. Now, after that, you have to read the directions. Follow the product's direction. If it says that you're going to mix with 2 tablespoons of that disinfectant, do it. Check or use sites and surface types to see where you can use the product. If it is okay to be used on top of counters, do it. If it is not, then don't. Read also the precautionary statements, like let's say after spraying, don't let the kids use the table. Please do that also. Warning. Another one is pre-clean the surface. When we pre-clean, that means we have to wash it with soap and water, which is, sometimes we have to take care of ourselves and the children as well by following the basic disinfecting procedure, which is you pre-clean it with soap and water and then wipe it and then spray some bleach if you're using bleach. And then if you want it to be air dried, be it. If not, just wipe it away too. But make sure that the cloth that you are using to wipe off the bleach is a one-time use cloth. That means you're going to use it to wipe it now and then throw it in the trash as well. Like paper towels, that is one-time use only. But not the towels that are bought somewhere or from stores and then you just wash it. That's not what it is. So make sure to wash the surface with soap and water if the directions mentions pre-cleaning or if the surface is visibly dirty. Of course, you do not put sanitizer immediately when you see that the surface is dirty. And then another one is follow the contact time. So contact time means the surface should remain wet the whole time before, so because that time is when the product is effective, before we can use the same surface again. So make sure we are following those protocols. It takes time, I know that, but you take time to encourage the children to follow and you, the providers, to know what they should do. All right. And then please don't forget to wear gloves. And then after taking off the gloves, please wash your hands after removing them. And then keep lids tightly closed and store out of reach of children. This could cause poisoning. This could cause skin rashes if you just put it somewhere on top of a table where children can reach. Actually, normally they are being hanged. That's why if you can see the bottle here, this one has a hanging thing. This is not only for us to pump the inside or the liquid, but that is also for hanging it on a shelf that is not reachable by children. So make sure you are into that as well. All right, so disinfecting and cleaning is another way of protecting yourself and others as well. Now, another thing that is very common is the use of face masks. No matter where that is made, whether it is cloth or the one that is really designed, the blue one that has some ties also, just like the first face mask that we see online. But I just would like to encourage you to take a look at this also. What are the do's and don'ts? All right. When putting on a face mask, clean your hands and put your face mask so it fully covers your mouth and your nose. So always remember that the band that is around your ears are elastic, meaning it's flexible. So if it is too loose for you, you just adjust it. Okay. And then another one is when wearing a face mask, don't do the following. Don't wear your face mask under your nose or mouth. Don't allow a strap to hang down. Don't cross the straps. That is not okay. Don't touch or adjust your face mask without cleaning your hands. So it should not be like up and down. If it is loose really the first time you wear it, check for that looseness, adjust it. It's flexible. Don't wear your face mask on your head, just like what is in the picture here. That's not it. That's not a headband. Don't wear your face mask around your neck like this one. Don't wear your face mask around your arm. So those are the don'ts. Next, when removing a face mask, clean your hands and remove your face mask, touching only the straps, those that are around your ears, and then clean. So you have clean hands already, and then remove it, and then wash your face mask if you can. And then after that, you clean your hands again, because there are droplets. I know that when you talk, there are droplets that are coming out of your mouth and your nose as well. So normally there is some moisture, so it is better that you wash it. Okay. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based sanitizer that contains 60% or more alcohol, 60% or more. And also, you know that 20 seconds, you can sing happy birthday or ABC 2 times, then you are done doing it. I think I had a video of that before already. Now, the next topic is about how to practice social distancing. Now, these are only some of the things that you can do. Buy groceries and medicine, go to the doctor, and complete banking activities online when possible. So online shopping is okay. They will just deliver. But when the goodies are there, sanitize them, disinfect them before you even open it. Do not open it right away and then it touches your hands, your clothes, everything on your body. That is just the same as like, oh, I am accepting all the virus on me. If you must go in person, stay at least 6 feet away from others and disinfect items you touch. See that? Even in stores, we are not encouraged to return clothes that we have worn or have fit in. Once you bought that, whether it is too big for you or too small for you, you cannot change it. You cannot return it for changes. Food, of course, food is not changed. You cannot exchange it too. Sorry. Now, I would want to talk too about quarantine versus isolation. Now, what is quarantine? When you are in a quarantine that keeps someone or you who was in close contact with someone who has COVID-19 away from others, right? So quarantine, meaning you should not be in contact with someone who has, or come in close contact with someone who has COVID-19. If you did not know that they have COVID-19, then that's the time for you to isolate yourself. Now, when you isolate, it's either you have contacted a person who is positive, or you are sick, or you have been tested positive. You can isolate yourself from others in your home. You stay in your room for days and days and days, 14 days, before you can even, I don't know how to, well, probably you can, if you only have one bathroom, that would be something that you have to think about. All right. Get deliveries and take out and limit in-person contact as much as possible. So take out, get deliveries, curbside, pick up, something like that could be some best things to do. Now, in a quarantine, you had close contact with a person who has COVID-19. Stay at home for 14 days after your last contact. Check your temperature twice a day and watch for symptoms of COVID-19. Please do not lie, be honest. Stay away from people who are at higher risk for getting very sick, like old people, babies. You should not come in contact with them if you know that you are sick. Now, another one to consider too is you are sick and you think or know you have COVID, stay at home until after 3 days with no fever. Symptoms improve in 10 days since symptoms first appeared. So all in all, it's 14 days too. If you tested positive for COVID-19 but do not have symptoms, asymptomatic they call it, stay home until after 10 days have passed since your positive test. If you live with others, stay in a specific sick room or area and away from other people or animals, including pets. Use a separate bathroom if possible. So that was what I was saying a little while ago. Now, for providers, in order to keep safe during this health crisis, frequent hand washing, that's one. When you arrive at the facility, wash your hands. After your break, because you ate something, wash your hands. Before and after preparing food or drinks for the children, wash your hands. Before and then before and after eating or handling food again. Before and after administering medications if they are sick. But if they are sick, please do not allow them to come to the center anymore. Before and after diapering, so there's a lot of frequent hand washing here. After using the toilet or helping a child use the bathroom, of course, we are on that page already, even before the pandemic. After coming in contact with bodily fluids are in your nose, I mean the mucus from the nose, saliva, pee, and poop, those are bodily fluids. And after playing outdoors or in the sand, and after handling garbage. So those are the incidents where you have to wash your hands. Remember the before and after, okay? So frequent hand washing. Another one is cleaning and disinfecting. Although this is the second round already, minimize the use of shared supplies that cannot be sanitized. What are those supplies that cannot be sanitized? Some of them are dough, Play-Doh. You cannot sanitize Play-Doh or else you just throw it away. So don't let them use Play-Doh. Instead, you can have substitute probably. What are your substitute? Probably plastic, what do you call this? Plastic Legos and what else? Plastic Legos. Plastic things can always be washed. So there is nothing to worry about it. You can always sanitize them. But those that are always at a risk of transferring viruses, please just don't. All right. Establish procedures for cleaning and disinfection. How do you do that? So first of all, you have your COVID-19 emergency plan. You please try to follow that. Avoid letting the children use the carpet. They are porous materials, rugs, or other sitting areas that are porous. So they are not easy to disinfect. So let them use some kind of wood or a plastic mat that is easy to clean and disinfect, because soft and porous materials, they can only be laundered, they can only be washed. So in order that you are not going to be doing it every time, you try to choose activities that limits the kids to be using a certain covering. And then here are some of the items that should be regularly cleaned: doorknobs, light switches, stair rails, counters, tables and chairs, shared toys, program equipment, indoor slides, something like that, and other items should be cleaned and regularly disinfected. And then you have to have routine cleaning and disinfecting daily. Routine, meaning not only daily, not only like before the kids come, you have to at least sanitize all the surfaces in your classroom. And then as they use it, after moving to another space, you have to sanitize the space where you previously used. Please, just do it. Just do it. And then cleaning cloth, face coverings, and face shields also. Well, there is always something which guides us to who are supposed to use face mask. Kids can use face mask if they know how to take it off, and they will not be entangling their ears, or they will not be suffocated, you know. So you have to let the mommies wash their face shields, not you, of course, only the mommies. Tell them that that should be cleaned every now and then. All right, during arrival and departure of children, this is one important thing also. Pick up and drop off should occur outside. So you take them out from the outside. Maybe the mom could just stay outside, and then consider use of multiple entrances and exits. You have to have barriers. You have to have some notification that they should go this way and they should be out this way. And screen children as they come in. How do you screen children as they come in? If you want to have a complete screening device, you have to have a handy thermometer that should be disinfected every time you transfer it to another child as they come in. Okay, so what you will do is track their blood pressure, track their temperature. Their temperature should be 100.4 degrees Fahrenheit. More than that, or from 100.4, should not be admitted to the facility. So remember that once you take them in, then some other kids are already exposed to the same thing too. Okay, and you may not use a PPE if you can maintain a 6 feet distance every time. Personal protective equipment. So there is always a reason for us to do the routine cleaning, hand washing, and for arrival and departure. Now, let's take a look at what do you plan to do for sick children. One is conduct daily health checks and then compare it. Like if you are trying to monitor the temperature, please make sure that you are conducting this on a daily basis. Follow exclusion guidance. We have already exclusion routine. Like if one kid is sick, they have to stay away from the group until the mom comes up and pick them up. And please make sure that all these plans are discussed very well with parents. Now, providers should take every precaution and watch for temperature changes of the students. So make sure you are monitoring their temperature. And always follow social distancing and other sanitary measures, which is developed by CDC. And CDC is Center for Disease Control. All right, social distancing throughout the day. Now, always limit group sizes as much as possible. If you have 15 kids, group them into 3 maybe, so that there will only be 5 in its group. And then be consistent with their groupings. So all 5 will be staying together. We just have to do this because of the pandemic. We could always group them again maybe tomorrow. Always remember that this is for their own safety and ours as well. And then there should be some visual cues or barriers. I told you already about where to exit, where to go in. So the flow of traffic and distancing will be some stores, they have X's. That means you just have to stand on that X. You should not be before that X because that is already measured like 6 feet away from the other person. Now, during nap also, space out nap time mats. That means you are going to have the head of the first child should be no, let's say the feet of the first child should be on the head, next to the feet of the first child will be the head of the second one, and so on. Spacing out, meaning you still have to follow social distancing. It is very essential that we do that, such that if one of the child coughs, the one that catches the droplets will be the feet of the next person. You understand? I hope you get what I was pointing out. All right. And other helpful tips would be, children should not wear cloth face coverings unless they can reliably wear, remove, and handle the cloth mask. And keep windows and doors open where possible, if it is possible. Make sure that there is somebody who is watching their every move too. Stagger playground use rather than allowing big groups to play together. So that means you do not have playground every now and then and allowing big groups. Remember I told you maybe 5 at a time. Plate each meal and serve in individual classrooms. Plate meaning it's not buffet this time. It's not family. Family method. Plan for a virtual field trip. You do not go out and bring the kids with you. Virtual trip would do. I have one virtual trip also. It's in the zoo, so you may visit that one too. Always remember, communicate this plan with your families. Do not just leave it like, oh, that's okay. They will know, they know that. Do not assume that they know that. Please do not assume. Do not always assume. Make sure you're telling them in print. They should be on posters and then explain to them. All right. So this is all for today. The resources that I have used is only www.cdc.gov coronavirus. It is very, it just appears once you click this one. And thank you so much for watching. And if you want to like and subscribe with this channel, I am at earlychildhoodteachingthoughts.com, or I am always playing some videos with early childhood. So you just type early childhood, my YouTube channel will always be there. Thank you so much, and I hope you learned something, how to avoid yourselves and protect others from COVID-19. This is part of our emergency plan for COVID-19. Thank you so much and have a wonderful day. This is Membran Felizarte, and I wish you all the best, and I wish that everybody is healthy and strong for the next days to come. Bye.